Today, parents brought this 14-month-old female with complaints of black spots temporal to the limbus in the left eye, and she is unable to see at night or in dark even at daytimes. So when I examined her, I found bitot spots in the left eye conjunctiva and diagnosed her as a case of vitamin A deficiency. Now, what are the bitot spots? These are the triangular patches of the xerosed conjunctiva with a layer of foam on the surface, usually located temporal to the cornea. Vitamin A is required for the development of the normal epithelium. Vitamin A deficiency produces bitot spots through metaplasia of conjunctival epithelium and tangles of keratin admixed with Corynebacterium xerosis. Foamy appearance is due to the gas produced by these bacteria. Vitamin A is stored in liver and zinc is required for mobilization of retinol from the liver. Vitamin A deficiency, according to WHO, categorized the ocular manifestations as XN for night blindness, X1A conjunctival xerosis, X1B bitot spots. So our patient was X1B. X2 corneal xerosis, X3A corneal ulcers, X3B keratomalacia, XS corneal scarring, and XF xerophthalmic fundus. So for mild disease, patient can get vitamin A from the cod liver oil, eggs, milk, orange, yellow fruits like mango, papayas, then dark green leafy vegetables like spinach, broccoli, then roots like carrots, and commercially available multivitamin syrups contain 5,000 international units in one spoon. That's enough for the daily requirement. In xerophthalmia, if the child is less than 6 months, 50,000 units for 2 days, consecutive days, and repeat the third dose after 2 weeks. If the patient is 6 to 12 months old, 1 lakh units for 2 days, consecutive days, and then repeat the third dose after 2 weeks. And if the patient is more than 1 year age, except females of the reproductive age, then the dosage is 2 lakhs for 2 days and the third dose after 2 weeks. Females of reproductive age with night blindness and bitot spots, 5,000 to 10,000 units per day. In high doses, it can be teratogenic in a pregnant ladies. Improvement of bitot spots occurs within 2 weeks of high dose vitamin A therapy, but night blindness can take 4 to 6 weeks to resolve. So whenever you encounter such patients, you should ask about the dietary habits. You should also see malnutrition, because most of the patients are malnourished, and if there is no malnutrition, like in our case, you should just tell them the food sources rich in vitamin A, that she should take those, and multivitamin syrups should be prescribed, because that's all at this stage of bitot spots that is required. In a severe malnourished patients, you should give those therapy of 50,000, 1 lakh, and 2 lakhs international units. So I hope you understand now. Thank you.